But what about my medical patients?
Okay, let's start with a standard medical presentation. Miss O is an 82-year-old woman with a diagnosis of pyelonephritis. She has no known drug allergies and no relevant past medical history. Given this information, what is the first line of treatment? If we look at the therapeutic guidelines, the first line of treatment is ampicillin and gentamicin. If the patient is allergic to penicillin, then gentamicin as a single agent is first line. And if gentamicin is not appropriate for your patient, then ceftriaxone or cefotaxime is first line. Cephalosporins are the last line agent for pyelonephritis. As well as being big contributors to antibiotic resistance, they are not active against Pseudomonas, Enterococci, or ESBL-producing organisms. And as we know, gentamicin-containing regimes will exhibit a post-antibiotic killing effect.
Okay. But how about pneumonia?
Until now, we have been giving the impression that ceftriaxone is an evil drug. In reality, though, ceftriaxone is more down on its feet. In the top-end wet season, all year round, we get a number of microbes which aren't found in the southern states. We need to cover organisms like melioidosis, which is where ceftriaxone comes in handy for top-end patients because it helps to suppress melioidosis infection. Acinetobacter baumannii is also a potential pathogen for top-end patients, so we cover our pneumonia patients with gentamicin. If we take a look at the pneumonia guideline for top-end, you will see that gentamicin and ceftriaxone are recommended for moderate pneumonia where a patient has high risk factors, and for severe pneumonia in all patients. Risk factors include diabetes, hazardous alcohol use, chronic lung diseases, or chronic renal failure. If we look at the rates of bloodstream infection in community-acquired pneumonia patients, we will find that Staphylococcus pneumonia still makes up the majority of cases of bacteremia, for which benzylpenicillin is still the best option.
This is all too confusing.
It is really confusing navigating between what conditions should follow top-end therapies and which should follow the therapeutic guidelines. To make it simpler, we've put them together in one place. Inside TEAMS, we have all the common presentations for top-end patients. If we click on pneumonia, then answers the following question, it leads us to the correct treatment for our patient, as well as approval codes for prescribing restricted antibiotics and information about pneumonia, which is specific to the top end. If you have any questions, call IFD through the RDH switchboard, or you can page AMS team on 0124. Thanks for watching.